This. Okay, so what we're doing is dissecting the sheep eyes. So the first thing you want to notice is on the outside we have the cornea. This is the clear layer over the top of the iris of the eye, all right, the colored portion. Then we'll notice that we've got these four muscles. These are the rectus muscles of the eye. You have superior, inferior, medial, and lateral. So these four muscles, and they're rectus muscles because the fibers run straight back, all right, when we do that. In addition, we're going to have these oblique muscles. You have a superior and inferior oblique muscle, which allow you to roll your eyes around, okay? The other structure on the outside that we're going to look at is going to be on the posterior side here, all right? This is my optic nerve right there. So it's coming out the posterior side of the eye. It is the axons that are coming from those photoreceptor cells. All right, and again, we've seen the optic nerve at the optic chiasm in the brain. All right, so this is the beginning of that particular portion. All right, so what I'm going to do next is go ahead and take the scalpel, and I'm going to make a coronal cut. All right. So I'm just going to poke that a little bit, all right, and then what I'm going to do is pour out the liquid, all right. This is aqueous humor that I'm pouring out. It's liquid, it's watery, aqueous meaning water. This is the fluid directly behind the cornea, okay, and in front of the lens. So it's one of two fluids that we're going to have in our eyeball, all right. So that's the aqueous humor. I'm going to finish my coronal cut. I'm cutting through the sclera, which is also known as the white of the eye, and the other name of it is the fibrous tunic because it's very, very tough. All right, so now I've pulled off the front section of the eye. Again, this is the cornea right here. If I flip this over, all right, and turn it inside out, all right, now you can see the cornea, see the clear there? All right, so we're looking backwards through the eye. You can see this is the pupil that we're looking through, and we're looking backwards through it, so we're seeing the clear portion of it. This brown layer here is going to be the iris of the eye. So this is your colored portion of the eye. And if you look closely, you can see the radiations of it, all right, the lines. So these are what are going to constrict or dilate to change the diameter of your pupil. All right, so we got all that. All right, now if I take out the next part of the eye, all right, so see this jelly-like fluid? So this is the vitreous humor. The vitreous humor is behind the lens and holds the retina in place. This brown structure that I have here is the lens. Okay, it's protein, so it's been denatured. It should be clear, it should be flexible. Right now it's hard, it's like a marble, because we've denatured it because of the preservative that it's been in. Okay, so this is my vitreous humor, and again, the job of the vitreous humor is to hold my retina in place. So see this tan, I'm going to pull this up just a little bit. All right, so I can pick up this brown tan layer that I have here. This is the retina. When I do this, all right, so this is known as your neural tunic, or this is where your photoreceptor cells are. So when we're talking about vision, this is where we need that light to get, is right on this tan layer. So pretty much I can scrape all of that retina off the next layer. The only place that it's actually physically attached is the optic nerve. So other than that, we rely on the vitreous humor to hold that retina in place. Okay, so once I've scraped that away, you can see, oops, sorry. You can see the black layer. See the black layer that I have here? This is my choroid layer. I'll bring it around, all right? So this is the choroid layer that I have here, the black layer. All right, this is also known as my vascular tunic. All right, the vascular tunic is where all your blood vessels and your lymph vessels are located. So right now when I look into your eyes or you look into mine, you're looking through the pupil, it looks black. because what you're seeing is that choroid layer, okay, that black layer. There's no light bouncing around in there that you can see to lighten it up. Now, this is an animal's eye, so notice the difference in that we have that iridized blue-green layer over the top. Can you see that? All right, so that iridized blue-green layer is known as the tapetum lucidum. The tapetum lucidum is there for night vision for them. So if you take a picture of your dog's eyes or your cat eyes at night, what do they look like? They glow. Okay, the reason they're glowing is the light is coming into their eye, it's bouncing around in this posterior compartment, and the light is being refracted off of that tapetum lucidum. So their eyes glow that kind of, you know, blue, green, white color. Okay, if I take a picture of your eyes at night, what do I get? Red eye, okay? Because your eyes do not have the tapetum lucidum. All we have is the choroid layer, which is blood vessels. So when the light gets in there, it lights up the inside of the eyes, and we're seeing your red blood vessels. That's why your eyes show up as red. So if we take red eye reduction, what a camera does is give you a pre-flash, it shrinks the size of the pupil, and then the light doesn't get in there and bounce all around anymore. Okay, so again, this black layer is my choroid layer. In an animal, it's covered with the tapetum lucidum, which is that iridized structure. So if I pull this away, my deepest layer that I have is going to be the white of the eye. And again, this case, it's not really white because it's been denatured. It's also known as the fibrous tunic, and it's what gives your eyeball its shape. So sclera, white of the eye, fibrous tunic. Choroid layer, vascular tunic, blood vessels and lymph are located there. If it's an animal, it's got that additional covering, which is the tapetum lucidum, and then the innermost layer is going to be the retina, the neural tunic, or where the photoreceptor cells are located. That's pretty much it.